Hello, my name is Danielle Haskin. I am the director of the Equity Office for the Frederick County Health Department. I started the health department because of COVID. I just reached out like, okay, what do I do if I don't have a car? Because like, remember the first testing center was across from the hospital at the care clinic, and you had to have a car and you had to walk up. So I reached out, I'm like, what if I don't have a car? What if I can't get to that testing clinic? Because people were asking me, and then I didn't know what to say. So I literally emailed the mayor, Jan Gardner, and Dr. Brookmeyer, and I was like, what do I tell people? Dr. Brookmeyer responded like, we're trying to figure it out. Do you want a job? So I literally was like, yeah, let's figure it out. Came on. And then immediately I was like, we got to get into this side of town, just conversation, right? Like, so I've been involved in knowing just, okay, it's a city, just the challenges that the community was saying. So I'm like, okay, we have to get on this side of town. So I was like, I wanted a brick and mortar. It made sense the brick and mortar was here, and I want us to be out. I want us to have something in each, borough. We were in Brunswick, Emmitsburg, Thurmont. We went to Mount Airy a couple times. Like, I want us to be out in the communities, somewhere. And then when it was winding down, I'm only here for COVID, right? So I was like, well, I love what I've been doing. And we have tons of questions not related to COVID. People don't know what we do as a health department. They don't know what resources are even available to them, let alone how to access it. So I'm like, why don't we just stay here? I was like, a satellite office. It's not unheard of. We'll be a satellite office. We'll offer similar resources, whatever we can easily transport. We're here. And so this is the fruition. I think in my mind, I was thinking like, everybody be gung-ho, like, let's go, we'll be here. We'll have all of our services here. I want to be here. Everybody didn't feel that way. And so I was surprised initially. Aging and Independence was here from day one, 5 days a week, offering like 4 or 5 different services. At least we have DSS starting now. They want to be here. It's a little of a slow burn, but I told you my motto, like, be the person you needed when you were younger. And not even like when you were younger, like yesterday I was younger than I am today. Like yesterday. A whole adult, yes. We're figuring it out together, and sometimes that vulnerability to be like, I don't know the answers, but I'm here to find out with you. And like, literally that's what I see myself doing, is like, we're finding out together. I don't see myself as leading anything. I see as like, I'm finding out with a lot of people who've been asking these questions a lot longer than I have. Like, I'm just now getting here. But because God put me in places, like, I'm able to ask different people, and it's just, yeah. The future of the health department on the west side. Well, it's already one of several. We're not the only satellite office. So I see the future as multiple satellite offices. As somewhere where really you can walk in the door and walk out the door served. You got what you needed plus more, where you felt heard, where you were shocked at how easy it was, and you want to tell others about how easy it is, and that you have friends and supports within the health department. We don't know all of the answers, but we are here to help you find what you need. If you listen, all you have to do is listen. Like, I truly believe it. People will tell you what they need. People